So, What Matters to Me project, a shift in relationship between health and care professionals and people. There's been some work undertaken by NHS England's South West Integrated Personalised Care team about how to change the relationship between healthcare professionals and people. This is about giving people the voice about what matters. So as you can see from the infographic in front of you, this is about being asked what's the matter, changing from what's the matter with you to being asked what's the matter to you. And again, shifting the relationship and the conversation of being told what is wrong with you and how your health needs will be met shifts to being valued as an active partner in a conversation and decision about health and well-being. The personalised care model has 7 components. And the components are relating to shared decision-making, personalised care and support planning, and then we're looking at NHS at home, social prescribing and community-based support, supported self-management, and personal health budgets and integrated budgets. In the long-term plan, the NHS has identified key changes that needs to occur, and through personalised care, this is their goals. Of course, COVID-19 and the vaccination programme between 21 and 22 has adversely impacted on the goals set against these components. But we are still pledging a commitment as a system to ensure that we are contributing to those national ambitions. In our county, we've been working with a project with lived experience people, our health and care professionals, to look at the various care plans being produced. We know that there are challenges in terms of sharing information between our respective organisations, and importantly for you as individuals supporting and caring for your loved ones in terms of managing the information, so producing once and using many times. We currently are using a care plan called Respect for people living with long-term conditions, and also Me at My Best, again living with a long-term condition dedicated to frailty. We created a folder, the What Matters to Me folder. This folder belongs to you. This folder will host your key personalised care and support plans. It's part of a pilot. We have procured 6,000 copies of the folder, and we are asking all system partners to pledge a commitment to mobilise the folders with their registered people who are living with a long-term condition. An example of the folder opened up and with some of the key care plans in there, you can see that the first pocket wallet will contain information all about me at my best. So how are you able to manage your condition and how you are at home with your condition? You may have an episode that you go into hospital and the consultants have asked that perhaps your hospital discharge letter containing information and supporting you following your operation can be hosted in this middle pocket wallet. You may also be accessing other supported care, such as the HOPE programme for long COVID or the HOPE programme for MSK. Anything that supports you, provides and outlines goals of care is to be held in this pocket wallet. The third pocket wallet is important to you. So this is information about advanced care planning. So in an emergency, what medical intervention needs to happen for you? Do you need to go into hospital? Do you wish to go into hospital? Or do you need signal that you wish to stay at home? This care plan, the Respect Care Plan, gives that information, provides a paramedic, a GP out of hours to look through this information and follow your wishes. We have started to launch this across our system, and examples of some of the primary care networks who have pledged a commitment include colleagues from the South Cotswolds and the North and South Gloucestershire PCNs. I'm pleased to say that we've actually now onboarded all of our localities. It is slowly being mobilised, and bearing in mind we only have 6 copies to issue to people by the end of March 2023. So we ask that you are patient with us, but if you are invited to have your folder and the contents, that you will keep this document and keep it live in the home and work with health professionals to share the information. I'll stop sharing my screen now. But basically, any information around the What Matters to Me folder and the contents, please do reach out to me, and we are happy to work with Gloucestershire Carers Hub to explore how we can mobilise the folder with yourselves as part of this trial.
Thank you.
Back